Hi friends, once again welcome back to the Nurse channel. So as you all know that the AIIMS NORCET examination, which is scheduled on June 3rd, is getting nearby, and I believe that you all are preparing very well for the upcoming examination, and you have very limited time in front of you, so prepare well for the examination. So to aiding you, to help you to prepare well, we are with the AIIMS series, AIIMS NORCET series, and this is our 13th video, which contains 15 important, very important questions, which includes previously asked questions, picture based questions, picture based explanations, etc. That definitely will help you to prepare very well for the upcoming examinations. So I believe these questions will help you and will aid you in preparing well. And this series also contains 15 questions, as I explained before. So whoever not yet subscribed our channel, I request everyone to subscribe our channel and support us, and kindly watch the video till the end, because explanations are also very important. Okay, so without losing time, we will move on to the 13th series in the AIIMS NORCET series, and here comes your questions.
The 13th NORCET series, the first question for you in the screen right now. So the question is, which among the following are the complications of uremic syndrome? So here the question is regarding the complications of uremic syndrome. So the options for you are: option number A, flapping hand tremors; option number B, an elevated hematocrit level; option number C, hypotension; and option number D, hypokalemia. So just think about what is uremic syndrome, and secondary to what diseases this uremic syndrome can come. So if you know these points, then you can answer these questions very easily. So the answer for this question is option number A, that is flapping hand tremors, otherwise known as the asterexis. Okay, so we'll have a small explanation regarding this question. So first of all, you have to understand what is a uremic syndrome and what is uremia. So uremic syndrome, it can be defined as the terminal clinical manifestation of kidney failure. Okay, so it is a terminal clinical manifestation of kidney failure. So uremia, it can be defined as an excess in the blood of amino acids and protein metabolism end products. That means that can be urea and creatine, which would be normally excreted in the urine. So these things will be, these by waste products like urea and creatine, it will be excreted normally by the urine, but that excretion won't properly happen, and as a result it can build up in the body and can result in uremia, and it is the final clinical manifestation of kidney failure, and it can be called as a uremic syndrome. Okay, so in uremic syndrome, what all things can be seen? So the question was regarding the flapping hand tremors. So asterexis, which is more colloquially referred to as the flapping tremor, it is a tremor of the hand when the wrist is extended, sometimes said to resemble a bird flapping its wings. Okay, so that's why it is known as the flapping tremor. Then what is the reason why this tremor is coming? The tremor is caused by abnormal function of the diencephalon motor centers in the brain. Okay, so which regulate the muscles involved in maintaining the position. Okay, so this is causing because of the urea can irritate the nerve endings or the nerves in the brain, and can resulting in the formation of flapping hand tremors, otherwise known as the asterexis. So from the first question, you are getting information regarding what is uremia, what is uremic syndrome, and what is asterexis, and what is the pathology behind asterexis. Okay, so that's all regarding the first informative question. So now we will see the second question. So the question is, which among the following is associated with aplastic anemia? So clinical manifestation of aplastic anemia is asked in this question. So the options are: option number A, bowel function disturbances; option number B, peripheral sensation; option number C, bleeding tendencies; and option number D, intake and output. So what is associated with aplastic anemia? So the answer for this question is option number C, bleeding tendencies. So I think it is a very easy question. So just you want to understand what is aplastic anemia. So what is aplastic anemia? So aplastic anemia is a severe hematological condition in which the body fails to make blood cells in sufficient numbers. Okay, so these blood cells includes everything. So aplastic anemia decreases the bone marrow production of RBCs, WBCs, that is white cells, and also the platelets. So as a result, the client is at a risk for bruising and bleeding tendencies. So the answer for our question is bleeding tendency. Okay, so I think that is clear. Simple question. Now I think we can move on to the third question in the series. So the third question, this is from the nursing education. So which system of education was propounded by Mahatma Gandhi? So which system of education was propounded by Mahatma Gandhi? So the options are option number A, teaching by activities. Option number B, teaching through music. Option number C, teaching through listening, meditation, etc. Then final option number D, all of these. All the options. So what is the answer? Gandhian philosophy of education, that is the term that you have to remember while answering this question. So it's a simple question and the answer is all of the options what I have given. So in short, we can tell like Gandhian philosophy of education means by education I mean all around development, drawing out of the best in the child, man, body, mind and spirit. Then literacy according to him is neither the end of education nor even the beginning of education. Okay, so it is one of the means whereby man and women can be educated, and literacy in itself is not education. Okay, so that means education in all ways. So we have given so many options, like you can see here, teaching by activities, teaching through music, teaching by listening, teaching through meditation. So it is the all-round development in all means. So all the options what I have given is the answer for Gandhian philosophy of education. Okay, so just a small information for you. So now I think we can move on to the next question in our series, the fourth question. So the question is, which one of the following cancer that does not metastasize commonly to liver? Okay, so I will be giving some options, and from these options you have to find out which cancer is not commonly metastasized to liver. So the first one is the breast cancer, second one is the lung cancer, the third one is the colon cancer, and the final one is the prostate cancer. So among this cancer, which is the least common cancer that can metastasize to liver? That is a question. So the answer for this question is obviously option number D, that is prostate. Prostate is the answer. So we know that prostate cancer is the development of cancer in the prostate, which is a gland in the male reproductive system, and most prostate cancers are slow growing. So this is very important. They are very slow growing cancers, and however some grow relatively quickly. So the cancer cells may spread from the prostate to other parts of the body, particularly the bones and the lymph nodes. Okay, so it may initially cause no symptoms. So in later stages, it can lead to difficulty urinating, blood in the urine, or pain in the pelvis, back, or when urinating. Okay, so the disease known as the benign prostatic hyperplasia or BPH may also produce similar symptoms. Okay, so initially they won't spread to the other parts of the body, even though if they spread also, they will be spreading to the bones and also to the lymph nodes, not to the liver directly. Okay, so some tumors, some prostate cancers at the end can metastasize to liver, but commonly prostate cancers won't metastasize to liver. Okay, so that's why that comes the importance of this question. Okay, that's all regarding the question. Now we will see the fifth question in our series from community health nursing, and the question is, Molluscum contagiosum is an infection caused by which virus? So the question is, Molluscum contagiosum is an infection caused by which virus? So the options are option number A, papilloma virus, option number B, pox virus, option number C, Epstein virus, and option number D, herpes simplex virus. So I can give you a clue, like this Molluscum contagiosum are some of the secondary infections that can be seen in immunosuppressant patients like HIV patients. Okay, so in that the Molluscum contagiosum is very, very important. That's why I have chosen this question for you. So the answer for this question is option number B, that is pox virus. Okay, so pox virus in several forms, it can affect the people with immunosuppressants, okay, with low immunity. So we will have a small explanation regarding this question. So Molluscum contagiosum virus, it is a species of DNA pox virus that causes the human skin infection, that is Molluscum contagiosum. Okay, so this pox virus impact can be through several routes. It can have the impact on immunosuppressant patients like HIV patients. So for example, see, like between 10 to 20% of the patients with symptomatic HIV disease or AIDS have the Molluscum contagiosum, and usually the lesion of this disease in HIV infected patients are multiple skin sores will be there, that up to 100 or more. Okay, so in most of the patients, this Molluscum contagiosum lesion is found to be extragenital. Okay, so multiple lesions or multiple skin sores will be there, and along with that, the peculiarity is that it is found to be extragenital. Okay, so as I told before, the pox virus through the respiratory tract, it can cause the variola or the smallpox, and through the oral route in immunosuppressant patients, it can cause ectromelia. Okay, so these are the additional two information that I can pass to you. So in immunosuppressant patients like HIV patients, this pox virus infection can have different routes, like already through the skin we have the Molluscum contagiosum, through the respiratory tract smallpox, and through the oral route ectromelia. Okay, so these are some additional information that will aid you in preparing well for the examination. So that's all regarding that question. Now we can see the sixth question in our series from the central nervous system. So the question is, facial nerve divides into its branches inside dash. So several times we are getting questions like related to Bell's palsy. So this is a different question. Okay, so this facial nerve is getting its branches from where? Okay, where it is getting divided, that is a question. And the options are option number A, Pons, option number B, medulla, option number C, parotid gland, and option number D, submandibular gland. So where this Pons is getting divided? Okay, so I'll give you a clue, like the question is not regarding from where the facial nerve is originating. So that point is different, and from where it is getting branched, that point also is different. So you can answer this question now very easily. So the answer for this question is option number C, that is parotid gland. Okay, so we'll have a small discussion regarding this facial nerve. You know that the facial nerve, it originates in the pons. Okay, so origination is from the Pons, and the seventh cranial nerve, that is a facial nerve, passes through the stylomastoid foramen and enters the parotid gland. Okay, so this is the root of the seventh cranial nerve. So it passes through the stylomastoid foramen and it enters into the parotid gland, and it divides into its main branches in the parotid gland. Okay, so here comes the answer for our question. So I have some more informations for you. So these branches, it will get then divide into almost 7,000 smaller nerve fibers that reach into the face, neck, salivary glands, and the outer ear. Okay, so just think about the functions of the cranial nerves, then you will understand why this is passing through the face, neck, salivary glands, etc. So the nerve controls the muscles of the neck, the forehead, and the facial expressions, as well as perceived sound volume. So it also stimulates secretions of the lower jaw, the tear glands, and the salivary glands in front of the mouth. Okay, so in Bell's palsy, what all features we will get, that you can refer later. All these will be related to these areas where facial nerve is getting supplied. So Bell's palsy is caused by the inflammation within a small bony tube that is called as the fallopian canal. Okay, so these are some additional informations that will aid you in preparing better. Okay, so these are some additional informations that will help you. Okay, so that's all regarding the seventh question regarding the facial nerve, Bell's palsy. So now I think we can move on to the seventh question in our series. So this question, emotional intelligence refers to dash. So it's the question from psychology. Emotional intelligence refers to dash. So the options are option number A, how people view and understand the world. Then option number B, how people view and understand themselves. Then option number C, how people view and understand others. And final option, how people view and understand themselves and others. So what is the answer? Emotional intelligence. So slightly confusing options I have given. So the answer is option number A, that is how people view and understand the world. Okay, so that will be including everything. Okay, so themselves, others and their surroundings. Okay, so we'll have a definition of emotional intelligence. So emotional intelligence is most often defined as the ability to perceive, use, understand, manage and handle the emotions. Okay, so everything, not only ours or not only the things what we are, or not only the persons who are next to us, but it includes everything. So it is the ability to perceive, use, understand, manage and handle the emotions. Okay, so that is emotional intelligence. So another definition we can see, like, it is defined as the ability to understand and manage own emotions as well as recognize and influence the emotions of those around. So whatever it is, whatever around, that means the world around us. Okay, so that's why the answer for this question is option number A, what I have shown here, how the people view and understand the world. Okay, so that's all regarding the question regarding the emotional intelligence. So I think you got the point. So we can move on to the 8th question in our series. So the question is, which among the surgical procedure is done to relieve pressure in compartment syndrome? So this question is regarding compartment syndrome. So first of all, you should understand, you should know thoroughly what is compartment syndrome, its pathophysiology. Then you can answer this question very easily. So the options for you are option number A, open reduction and internal fixation, otherwise known as the ORIF. Then option number B, meniscectomy. Option number C, fasciotomy. And option number D, arthroplasty. So by doing which surgical procedure you can relieve the pressure in compartment syndrome. So from this you know that it is related to the orthopedics. So first of all, we will see the answer for this question. So answer is option number C, that is fasciotomy or fasciectomy. Then we will see what is compartment syndrome. So compartment syndrome, it is a condition in which increased pressure within one of the body's anatomical compartments, which result in insufficient blood supply to the tissue within that space. So because of the increased pressure in any of the compartment in the body, there will be insufficient blood tissue to the blood supply to that particular tissue. So compartments of the leg or arm are most commonly involved. Okay, so this is very, very important. Okay, compartments of leg or arm are more commonly involved. So what is the treatment? What is the treatment option is a fasciotomy or fasciectomy. So it is a surgical procedure where the fascia is cut to relieve the tension or pressure in order to treat the resulting loss of circulation to an area of tissue or muscle. Okay, so how fasciotomy helps? Fasciotomy is a limb saving procedure when used to treat acute compartment syndrome. So it is also sometimes used to treat the chronic compartment stress syndrome also. Okay, so these are the indications for fasciotomy or fasciectomy. So main thing is the relieving the pressure in compartment syndrome. Okay, so I think this question was asked frequently in AIIMS NORCET and other nursing officer examinations. Okay, then we will see the other options in the question. So what is a meniscectomy? So meniscectomy, it is a common orthopedic procedure which is done to alleviate the knee pain in the older population with meniscal pathology. So whenever there is a meniscal tear or meniscal pathology, then the older people, they can go for the meniscectomy. So it is typically performed on older patients with the meniscal tears that are degenerative in nature. Okay, so that is meniscectomy. Then next option was regarding the ORIF, that is open reduction and internal fixation. So it is a type of surgery which is used to stabilize and heal a broken bone. So that is not related to the compartment syndrome, not a treatment option for the compartment syndrome. Okay. Then another option was the arthroplasty. So arthroplasty means that is related to the joints. Okay, so it is an orthopedic surgical procedure where the articular surface of a musculoskeletal joint is replaced, remodeled or realigned by osteotomy or some other procedures. Okay, so this is the procedure that has been done in the musculoskeletal joints. Okay, so there it will be replaced, remodeled or realigned. Okay, so that procedure is known as the arthroplasty. So from this question you are getting information regarding fasciotomy or fasciectomy, then ORIF, arthroplasty, and the what I have already explained regarding the meniscectomy. Okay, so that's all regarding this question. Now we can move on to the 9th question in our series. So the question is, the early indicator of hypoxia in the unconscious client is dash. So the early indicator of hypoxia in the unconscious client. Okay, so here the key point is early indicator. Okay, so you have to find out the answer from the options. So for the first option, number A, cyanosis. Option number B, increased respirations. Option number C, hypertension. Then option number D, restlessness. So what will be the earlier indicator of a patient that is going to hypoxia? So the answer is option number D, that is restlessness. Okay, so before explaining that, I will give you a point that you can refer later. So this hypoxia, it is actually divided into 4 types. Okay, so that is hypoxic hypoxia, hypemic hypoxia, stagnant hypoxia and histotoxic hypoxia. Okay, so these are the types of hypoxia, and I am not explaining in depth about these hypoxias because from anywhere about, from this topic you can expect the questions. Okay, so you can refer it later. I am giving you some clues, some points to refer later. Okay, so my question was regarding the early signs of hypoxia. So here we can see the early signs of hypoxia are anxiety, confusion and restlessness. So if hypoxia is not corrected, then hypotension will develop. So as hypoxia worsens, the patient's vital signs, activity tolerance and level of consciousness will decrease. Okay, so the earliest sign is restlessness, confusion and anxiety. Okay, so that's all regarding the early signs of hypoxia. Okay, then there will be other options we have given, like hypertension, that some confusion may happen. So initially there will be raised blood pressure. Okay, so initially there will be hypertension will be there, then followed by hypotension, that is lowered blood pressure as the condition progresses. Okay, so I think that confusion also is clear. So that's all regarding the 9th question in our series. Now we will be seeing the 10th question. So the question is, Sideropenic dysphagia affects which organ? Sideropenic dysphagia affects which organ? Okay, so the options are option number A, esophagus, option number B, larynx, option number C, throat, and option number D, teeth. Sideropenic dysphagia. So dysphagia, from that you can find out the answer, but there will be slight confusion. So answers, option number C, throat is the answer. So we will have a small discussion regarding the sideropenic dysphagia. So it is a disorder which is marked by anemia. Okay, it is marked by anemia which is caused by the iron deficiency. So there will be iron deficiency, anemia will be there, and there will be a web-like growth of membranes in the throat that makes swallowing difficult. Okay, so in the throat is the problem, there will be web-like growth will be there. So having sideropenic dysphagia, it may increase the development of esophageal cancer. Okay, so that is sideropenic dysphagia. So the other names of sideropenic dysphagia is Plummer-Vinson syndrome or Brown-Kelly-Peterson syndrome. These are the other names for the disease. Okay, so once it was asked like which among the following are the other names for that sideropenic dysphagia. Okay, so these are the other names. So it is a rare condition which is characterized by the classic triad of post-cricoid dysphagia, iron deficiency anemia and upper esophageal webs. Okay, so that's all regarding the question. So here you may have a confusion like that esophageal webs will be there, but the problem it will be with the throat. Okay, so that's all regarding that question. Now we can move on to the 11th question in our series. So this is from the nursing research, and the question is, which hypothesis begins with specific observations and move towards generalization? Okay, which hypothesis begins with specific observations and move towards generalizations? So here the question is regarding the types of hypothesis. So the options are, first one is the inductive hypothesis, option number B is the deductive hypothesis, option number C is the null hypothesis, and option number D, directional hypothesis. So what is the answer? So here the answer is option number A, that is inductive hypothesis. So we will have the discussion regarding what are the difference between inductive, deductive, null, directional, non-directional, etc. So inductive hypothesis means, so it begins with specific observations and move towards generalizations. Okay, so from specific to general. Okay, so the researchers observe the certain patterns, trends or associations among the phenomena and formulation of hypothesis will be done. So if the hypothesis is chosen in that way, then we can call it as inductive. Then opposite to that, you can see that the deductive hypothesis. So what is deductive? So it means driving specific statements from general ideas, theories or principles. Okay, so the specific predictions derived from general principles and can be subjected to testing through collection of observed data. Okay, so that is deductive. So what is null hypothesis? So null hypothesis, it states that there is no relationship between the dependent and independent variables. So regarding these variables, we have explained through a question in our old series. So if there is no relationship between these variables, then we are telling it as a null hypothesis. Okay. Then another option was regarding the directional. So what is a directional hypothesis? So it specifies the expected relationship between the variables. Okay, expected relationship between the variables. Okay, that is directional. Then what is non-directional? So it does not indicate the existence or a direction of relationship between the variables. Okay, it's just opposite to the directional hypothesis. Okay, so from this you are getting information regarding the null hypothesis, what is directional, what is non-directional, and what is inductive and deductive hypothesis. Okay, so that's all regarding that question from nursing research. Now we can see the next question in our series, the 12th question. So which of the following is an indicator of AIDS? So the options are, option number A, CD4 count lower than 200 cells per cubic millimeter. Then option number B, CD4 count lower than 400 cells per cubic millimeter. Option number C, CD4 count lower than 600 cells per cubic millimeter. And option number D, CD4 count lower than 1000 cells per cubic millimeter. So what is the, among these, which is the indicator of AIDS? So the answer is option number A, that is CD4 count lower than 200 cells per cubic millimeter. Okay, so we know that according to the US CDC definition, a patient has AIDS if he or she is infected with HIV and also presents with one of the following. That means a CD4 plus T cell count below 200 cells per cubic millimeter, or a CD4 plus T cell percentage of total lymphocytes of less than 15%, or the person has one of the defining illnesses which was defined by the CDC. Okay, so these are the criteria to define that a person is having AIDS. Okay, the first one is the CD4 count, which is less than 200 cells per cubic millimeter, then infection with AIDS, and along with that any one of the defining illnesses which was laid down by the CDC. Okay, so this is a criteria. I think that is clear. Now we can move on to the 13th question in our series. So this is from oncology again. Which of the following stages of carcinogen is irreversible? So this is also a repeatedly asked, frequently asked question. So which of the following stage of carcinogen is irreversible? So we have given some stages. The options are option number A, initiation stage, option number B, progression stage, option number C, promotion stage, and option number D, regression stage, which is irreversible. So the answer is option number B, that is progression stage. Progression stage. So this is a through this picture you can get an information regarding the initiation, promotion and progression. So initiation means there will be DNA damage by oxygen and nitrogen radicals. Okay, that is a cause, that is DNA damage will happen. So in the promotion stage there is a proliferation of initiated cells, that these cells will be proliferated and there will be inhibition of the apoptosis. Then next comes the progressive stage, that means the induction of angiogenesis, that is the blood vessel formation will happen, and invasion and tumor cell migration also happens, that is that metastasis also happen. So a little more deeper, so initiation, it is the first step in the two-stage model of the cancer development, and these initiators, if not already reactive with DNA, are altered via drug metabolizing enzymes in the body and then able to cause changes in the DNA. That means that mutations will happen. Okay, so that is the initiation phase. Then comes the second stage, that is a promotion. So once a cell has been mutated by an initiator, it is susceptible to the effects of promoters. So these compounds promote the proliferation of the cell, giving rise to a large number of daughter cells containing the mutation created by the initiator. That mutation already we have explained. So now that daughter cells will be produced, and these promoters have no effect when organism in question has not been previously treated with an initiator. Okay, so there is no use, that is a main thing. So if the initiator is not treated well, then this promotion can progress. Okay, so that is promotion. Then comes the progression. So the progression refers to the stepwise transformation of a benign tumor to a neoplasm and to malignancy. That is the progression. Okay, so the three steps, I think you are clear. So we'll move on to the second last question in our series, that is the 14th question. So the question is, which of the following insulin has no peak but a duration of 24 hours? So the question is very simple, like there is no peak duration, but the duration will last for the 24 hours. So what is an example for such type of an insulin? So the options are option number A, NPH, option number B, Novolog, option number C, Lantus, and option number D, Humulin N. So among these, which is having no peak value? So the answer for this question is, obviously you know that that answer is Lantus. Okay, so we will have small explanation regarding this question. So Lantus, otherwise known as the glargine insulin, it is a slow, steady release of insulin with no apparent peak action. Okay, so one injection can last up to 24 hours and it is usually injected once in a day but can be taken twice daily based upon the patient's condition. Okay, so there is no peak value and the duration will last for 24 hours with Lantus or the glargine insulin. Okay, so what about the other options? So I will be giving you some examples for the rapid acting and the short acting insulin, and these durations, what is their peak level, that you can refer later, or I will include some questions regarding this topic in the next sessions. Okay, so the rapid acting insulin includes that the Fiasp and the Novo rapid insulin or the insulin Aspart, then Humalog or the insulin Lispro, or Apidra or the insulin Glulisine. Okay, so these are the examples for rapid acting insulin. And next is the NPH insulin. So it is an example for the intermediate acting insulin. Okay, intermediate acting insulin, insulin NPH. Okay, and here comes the last question for you. So the last question for you is a picture based question, and here is the question. So you have to identify this bone. Okay, so I have shown a bone here, so you have to identify this bone, and the options are ethmoid bone, sphenoid bone, parietal bone, temporal bone. Okay, so what is this bone? So all these bones forms the cranium. So among this you can find out what this bone is. So obviously the answer for this question is option number B, that is a sphenoid bone. Okay, so sphenoid bone, you can see the picture here. The sphenoid bone, it is a compound bone which forms the base of the cranium. Okay, and behind the eyes and below the front part of the brain. So it has two pairs of broad lateral wings and a number of projections and contain two air-filled sinuses, also known as the air-filled sinuses, and this sphenoid bone is also known as the wasp bone. So we can see several projections here. Two air-filled sinuses you can see here, then some orifices you can see here, and this bone is somewhat like a butterfly shaped bone. Okay, so these are the key points. See, these are the points from where you can identify a sphenoid bone. Okay, so this is a sphenoid bone. So I'll show you a picture. So this is a cranium. So this cranium is formed by these 8 cranial bones, which include one ethmoid bone. So ethmoid bone I will tell now. Then another is a sphenoid bone, which forms the base of the skull that you can see from inside. Then one frontal bone. Then 2 parietal on both sides. Then 2 temporal on both sides, and 1 occipital on the posterior surface. Okay, so total 8 cranial bones forms the cranium. And so this is the ethmoid bone. So don't be confused between the shapes of ethmoid and the sphenoid. So this ethmoid, the anterior portion and the posterior portion, I have given for you for a better understanding. Okay, so this is a picture of the ethmoid. Okay, so with that we are coming to the end of this session. So the 15 questions what we have explained today is very, very important, and I believe these questions definitely will help you to prepare better for your upcoming examinations. That is not only for the AIIMS NORCET but also for the other nursing officer examinations. Okay, so once again I thank everyone who watched this video till the end, and kindly keep in touch with us. So we'll be coming with the next series very shortly. Till that time, just signing out. So keep in touch. Thank you.